I want to tell you about a patient I will never forget. He was 68 years old, a retired teacher, healthy by every standard he knew. He exercised 3 times a week, took his medication every morning, and had a checkup just 4 months before. His wife kissed him goodnight at 10:30. By 3 in the morning, she woke up to silence, the kind of silence no one should ever have to experience. He had suffered a massive cardiac event in his sleep. No warning, no cry for help, nothing. And when I reviewed his case, the timeline, the blood work, the patterns, what I found was not a mystery. It was a series of completely ordinary habits he had been carrying out every single evening for years. Habits he shared with millions of people watching this right now. I am not telling you this to frighten you. I am telling you this because what happened to him did not have to happen. And with what I am about to share with you today, it does not have to happen to you either. Stay with me, because what I cover in this video may genuinely be the most important 12 minutes you spend this year. My name is Dr. Wilson, and I am a cardiologist with more than 30 years of clinical experience. In that time, I have treated thousands of patients for heart disease, heart attacks, arterial blockages, and cardiac emergencies. I have also spent years studying the one question that never left me alone, which is, why does the same type of patient, someone who appears to be doing everything right, keep ending up in a cardiac unit in the early morning hours? What I found was not a single answer. It was a pattern, a consistent, repeating set of evening behaviors that, individually, seem completely harmless, but together, night after night, year after year, create the exact conditions that make a heart attack or stroke far more likely during sleep. Tonight, I want to walk you through 5 of those behaviors. I want to explain exactly what each one does to your cardiovascular system after 60. And I want to give you a clear, practical alternative for each one, something you can actually implement starting tonight. Before we get into the habits themselves, I need to explain something that most people do not understand about the heart after 60, because without this context, the habits I am about to describe might not seem as serious as they are. Here is something I explain to almost every patient who sits down across from me for the first time after their 60th birthday. Your heart does not stop working when you fall asleep, and in fact, in some ways, what happens to your cardiovascular system at night is more important than what happens during the day. In a young, healthy body, sleep is a period of genuine cardiovascular recovery, where blood pressure drops by 10 to 20%. The heart rate slows, the blood vessels widen and relax, inflammation markers decrease, and repair processes that cannot happen during the busy activity of the day quietly get underway. Researchers call this the nocturnal dip, and it is not a luxury, it is a biological necessity, one that your heart has been counting on every single night of your life. Now here is what changes after 60. The arterial walls, which in younger years are elastic and responsive, begin to stiffen, a process called arteriosclerosis, the gradual hardening of the arteries that progresses quietly over decades. Plaque, a mixture of cholesterol, calcium, and inflammatory tissue, can build up inside the artery walls. The hormonal systems that regulate nighttime blood pressure become less precise, and the protective nocturnal dip, that 10 to 20% drop that gives your heart its nightly reset, becomes less reliable. What this means practically is that the margin for error gets dramatically smaller. During the day, your cardiovascular system has multiple compensating mechanisms, and if one system is under stress, another can pick up the slack. But at night, many of those backup mechanisms are inactive, and your body is running on minimal oversight. And here is the critical point that ties everything together. Research has consistently shown that the hours between midnight and 6 in the morning carry the highest statistical risk of heart attack and stroke for adults over 60. Not the morning commute, not a stressful afternoon meeting, but the quiet, dark hours when no one is watching. And what determines how safely your body passes through those hours is largely determined by what you did before you went to bed. Before we go further, I want to ask you something, and I genuinely want you to answer in the comments. Do you currently know your blood pressure reading from your most recent checkup? Yes or no? You would be surprised how many people over 60 cannot answer that question, and that number matters more than almost any other health metric after 60, which is exactly why we are going to talk about it right now. Let me ask you to think back to last night. What time did you finish dinner, and how long after that did you go to bed? I ask this question in my clinic constantly, and among patients over 60, the most common answer I hear is some version of, I eat around 8 or 8:30, watch some television, and go to bed around 10 or 10:30, sometimes later. I want to explain precisely why that timeline is working against your heart. When you consume a large meal, particularly one high in refined carbohydrates, saturated fats, or sodium, your digestive system immediately begins demanding more blood. And we are talking about a significant redistribution of your body's circulatory resources, where your heart has to pump harder and faster to meet that demand. Blood pressure rises, and blood triglycerides, the fats circulating in your bloodstream, spike sharply within 2 to 4 hours after eating. Now consider what happens when that process overlaps directly with sleep. Your body has a deeply ingrained biological expectation that the evening is supposed to be a transition toward rest, a gradual lowering of cardiovascular demand, so the system can begin its nightly recovery. And when you eat a heavy meal within 2 to 3 hours of sleep, you are essentially scheduling a cardiovascular work shift at the exact moment your heart is trying to clock out. The two demands compete with each other, and in a person over 60, where the arteries are less elastic and blood pressure regulation is already less precise, that conflict has measurable consequences. Studies have linked eating close to bedtime with higher nighttime blood pressure readings, increased triglyceride levels during sleep, and elevated cardiovascular risk in older adults. And it is also strongly associated with acid reflux, which can produce chest sensations that closely mimic cardiac symptoms, and in some cases trigger actual cardiac reflex responses. The solution is not a dramatic dietary overhaul, but simply a shift in timing. So try to finish your main meal by 6:30 or 7 in the evening, and if you are genuinely hungry later, a small snack like a handful of nuts or a piece of fruit is fine, because what you want to avoid is a full, heavy meal within 2 to 3 hours of lying down. Now, this next one I need you to take very seriously, because if you take medication for high blood pressure, and statistically the majority of adults over 60 in the United States do, the timing of when you take that medication may matter as much as whether you take it at all. In a healthy person, blood pressure follows a natural curve through the day, where it rises gradually in the morning, peaks in the early to mid-afternoon, and drops at night. But in a significant portion of adults over 60, particularly those with established hypertension, this pattern breaks down, and either the nighttime dip does not occur fully, or blood pressure actually rises during the early morning hours while the person is still asleep. Physicians refer to these patients as non-dippers or reverse dippers, and research has consistently shown that they carry a substantially higher risk of cardiac events during sleep. If you take your blood pressure medication first thing in the morning, it is doing its most active work during the hours of the day when your blood pressure is already rising and your body is alert and compensating. And by midnight or 1 in the morning, when the medication's effect may be wearing off, your blood pressure could be rising again, unmanaged, against arterial walls that are not braced for the impact. A landmark clinical study known as the Hygia chronotherapy trial examined this question directly and found that patients who took their antihypertensive medication in the evening showed significantly better nighttime blood pressure control and meaningfully lower rates of major cardiovascular events compared to those who took the same medication in the morning. What I want you to do with this is not change your medication schedule on your own, but simply have a 2-minute conversation with your physician and ask specifically, given my individual blood pressure pattern, is there a benefit to taking my medication in the evening? That conversation takes almost no time, and the impact of the answer could be enormous. Now I want you to think carefully about this next question, and be honest with yourself. Has anyone in your life ever told you that your snoring wakes them up? Have you ever woken yourself up mid-snore? Do you ever wake up in the morning feeling as though you barely slept, even after 7 or 8 hours in bed? In my clinical experience, when patients over 60 describe these experiences, the first word that comes to mind is not annoying, but cardiac risk. Sleep apnea, a condition in which the airway partially or fully collapses during sleep, causing repeated interruptions in breathing, is one of the most underdiagnosed cardiovascular conditions in older adults. And conservative estimates suggest that over 30% of adults over 60 have some degree of sleep-disordered breathing, with the vast majority never having been evaluated for it. Here is what is happening physiologically during an untreated apnea episode. Your airway closes, breathing stops, sometimes for 10 seconds, sometimes for 40 seconds or longer. The oxygen level in your blood falls. Your brain detects the emergency and activates the sympathetic nervous system. Adrenaline surges, heart rate spikes suddenly, blood pressure jumps, and then you partially wake. The airway reopens and breathing resumes, only for the cycle to repeat, and for some patients this cycle repeats 30, 40, even 50 times per hour throughout the night. Each episode is a stress event for your cardiovascular system. Each spike in blood pressure is an impact against already stiffened arterial walls. Each adrenaline surge affects the electrical stability of the heart, and over months and years, this pattern is directly linked to the development of high blood pressure. Irregular heart rhythms including atrial fibrillation, accelerated arterial damage, and substantially increased risk of both heart attack and stroke. The warning signs extend beyond loud snoring, so watch for morning headaches that were not there before, excessive fatigue during the day, regardless of how long you slept, waking up with a dry mouth or a sensation of choking, difficulty concentrating, and needing to use the bathroom frequently during the night. If any of these are familiar, please speak with your doctor about a sleep study, which is a non-invasive evaluation whose results can be genuinely life-changing. And that brings me to the second question I want you to answer in the comments. Has anyone ever told you that you snore heavily? Or have you noticed any of the warning signs I just described? Share below, because you may help someone else recognize something they have been dismissing for years. Now for a habit I call the logical trap, because the thinking behind it makes complete sense. And that is exactly what makes it so easy to overlook. Many people over 60 deliberately reduce how much they drink after about 5 or 6 in the evening because they do not want to wake up at 2 in the morning to use the bathroom. And disrupted sleep is uncomfortable, while getting up at night when you are older also carries a genuine fall risk, so they limit fluids in the evening, which seems completely reasonable. But here is what that decision does to your cardiovascular system during the hours you are asleep. When the body is even mildly dehydrated, and by the time you feel thirsty at night you are already there, the blood becomes more viscous. It thickens. Red blood cells move more slowly. The plasma that carries them through the vessels decreases in volume, and the blood does not flow as freely. In a young, healthy cardiovascular system, mild viscosity changes are manageable. But in a person over 60 with arterial stiffening, reduced vessel elasticity, and potentially some degree of existing plaque buildup, the combination of thicker blood moving through narrower channels is meaningfully more hazardous. Add to that the natural slowing of the heart rate and circulation that occurs during sleep. Add the fact that the body has been lying still and not moving for 7 or 8 hours, and you begin to understand why cardiovascular researchers have repeatedly identified the early morning hours, 3 to 6 a.m., as the window of highest clot risk and highest cardiac event rate in older adults. Dehydration is one of the contributing factors in that window, and it is one of the easiest to address. So drink 1 full glass of water, 8 ounces, in the 30 minutes before you go to sleep. Keep a second glass on your nightstand, and if you wake during the night, drink a few sips before going back to sleep, because that simple habit helps maintain adequate blood fluidity through the hours when your circulation is at its slowest. And finally, here is the one that surprises my patients the most, because it sounds almost too simple to be real. What temperature is your bedroom at night? Most people answer this in terms of personal comfort, saying they like it warm or they sleep better with the window open. But almost no one has ever thought about it in terms of what their cardiovascular system prefers. When a bedroom is too warm, above roughly 72 degrees Fahrenheit or 22 degrees Celsius, the body spends the entire night working to dissipate excess heat. Blood vessels near the skin stay dilated in an effort to release warmth. Heart rate remains slightly elevated. Sweating increases fluid loss, which brings us right back to the dehydration issue we just discussed. And critically, sleep quality drops. Specifically, the amount of time spent in deep, slow-wave sleep, which is the stage most associated with cardiovascular repair and blood pressure recovery. On the other end of the spectrum, a room that is genuinely cold, below about 65 degrees Fahrenheit or 18 degrees Celsius, creates a different set of cardiovascular demands. Because cold triggers vasoconstriction, meaning the blood vessels tighten to conserve core body heat, blood pressure rises in response, and the heart has to generate more force to push blood through tightened vessels, which for someone with existing coronary artery disease or hypertension means that nighttime pressure elevation is not trivial. The research-supported sweet spot for cardiovascular recovery during sleep is between 65 and 72 degrees Fahrenheit, 18 to 22 degrees Celsius, and within that range, the body maintains what researchers call thermoneutral status, where vessels stay relaxed, heart rate remains low and steady, and sleep stays deep and restorative. One thermostat adjustment, one habit that costs nothing, and genuine protection for your heart every single night. And that is my third question for the comments. What temperature do you typically sleep at? And after hearing this, are you thinking about changing it? I read every comment and I genuinely want to know. Before we move into the practical routine, I want to spend a moment on something that every person over 60 and every family member of someone over 60 needs to understand. The cardiovascular system will often send signals before a serious event occurs, but the problem is that those signals are frequently subtle, intermittent, and easy to explain away as something else. Unusual fatigue that appears without a clear reason and does not improve with rest can be an early indicator of reduced cardiac output, and it is commonly dismissed as aging, as stress, or as poor sleep. Shortness of breath during activities that previously felt effortless, like climbing one flight of stairs or walking to the mailbox, can signal that the heart is working harder than it should to meet ordinary demands. Chest discomfort that is not dramatic, not the crushing movie-style chest pain, but a vague pressure, a sense of tightness, or a mild ache that comes and goes, is worth reporting to your physician immediately and not monitoring at home. Palpitations. The sensation of your heart fluttering, skipping, or beating irregularly, particularly if they occur at rest or wake you from sleep, deserve prompt evaluation. And waking from sleep with a sudden sense of breathlessness or a racing heart, even if it resolves quickly, is a symptom that should never be dismissed as a bad dream. None of these symptoms are a diagnosis. They are signals. And in cardiology, we have a saying that the patient who reports symptoms early almost always has more options than the one who waited. And that is my fourth question for the comments. Have you or someone close to you ever experienced any of these symptoms and dismissed it as nothing? Share your experience below, because your story matters and it may help someone else watching today. I want to bring everything together now into something concrete, a simple evening routine that addresses every single one of the 5 habits we have discussed. And this is not a rigid protocol, but a framework, a set of reference points for your evening that, practiced consistently, gives your cardiovascular system the conditions it needs to recover properly every single night. Between 6 and 7 in the evening, finish your main meal. Focus on lean protein, vegetables, and a moderate amount of complex carbohydrates, and avoid heavy, fried, or high-sodium foods in the evening hours, because this is not a permanent restriction, but simply a timing adjustment that gives your heart 3 to 4 hours of digestive calm before sleep. At 7 in the evening, take a moment to review your medications, and if you have not had a conversation with your physician about whether evening dosing of your blood pressure medication might be appropriate for your specific blood pressure pattern, put that on your list for your next appointment, because that single question could be one of the most protective things you ask your doctor this year. Between 8 and 9 in the evening, begin your transition toward rest, which means reducing screen exposure, particularly bright phone and tablet screens that suppress melatonin and keep the nervous system in a state of alertness far longer than most people realize, and replace that time with something genuinely restorative like a short walk, light reading, a calm conversation, or some gentle stretching. Because your nervous system needs a genuine transition and not just a change of screens. By 9 in the evening, check your bedroom environment. Set the thermostat between 65 and 72 degrees Fahrenheit. Place a glass of water on the nightstand, and if you have been advised to avoid sleeping on your back, or if you snore heavily and have not yet been evaluated, make a conscious effort to settle on your side. Because back sleeping worsens airway obstruction and increases apnea episode frequency significantly. By 10 in the evening, you are in bed, lights off, in a properly cooled room, with water nearby, with dinner settled, and your medication managed appropriately. That is the entire routine, and it does not require supplements, devices, or lifestyle upheaval, only awareness and consistency. I want to say something to you directly before I close. I have spent more than 20 years in cardiovascular medicine, and I have seen the best and the worst outcomes this field has to offer. And if there is one thing that experience has consistently reinforced for me, it is this. The gap between a patient who does well long-term and one who does not is rarely about luck. It is almost always about information. Specifically, whether someone received the right information early enough to act on it. The 5 habits I covered today are not exotic or rare. They are found in the evening routines of millions of ordinary, well-meaning people who simply never connected those habits to what was happening in their cardiovascular system while they slept. You now have that connection, and what you do with it is yours to decide. Not next month, not after your next appointment, but tonight. 1 meal finished earlier, 1 glass of water on the nightstand, 1 conversation with your doctor about medication timing, 1 thermostat setting, 1 honest conversation with yourself about whether that snoring deserves a closer look. None of these things are hard, and none of them require sacrifice. What they require is the decision to take your heart as seriously as it has taken its job of keeping you alive every single minute of every single night for your entire life. Take care of it. If something in this video gave you pause, if you recognized a habit or something clicked that had not clicked before, I want you to share this video with one person in your life who is over 60, a spouse, a sibling, a close friend, a parent, because they deserve this information as much as you did. Hit the like button if this was valuable to you, because it genuinely helps this content reach people who need it, and subscribe and turn on notifications so you do not miss the next video, which is one I receive more questions about than almost anything else. We are going to talk about something that happens every day in hospitals across the country, procedures and surgeries that carry meaningfully higher risk for patients over 60, and the specific questions every senior should ask before agreeing to go under general anesthesia. And it is called Never Agree to This Without Asking. These questions. First, 5 surgeries that carry much higher risk after 60. If you or someone you love is approaching a surgical recommendation, that video could be one of the most important things you watch, and I will see you there. Thank you for staying with me through this entire video, and that tells me you are someone who takes their health seriously, which I deeply respect. Click right here to watch my next video on the 5 surgeries that carry significantly higher risk after 60 and what to ask your doctor before agreeing to any of them, because it could be one of the most important things you watch this year. And as always, everything shared here is for educational purposes only. So please work with your own physician for decisions about your personal health and medications. Good night, sleep well, and take care of that heart.